Okay, so Joanne, if you can take it away, thank you so much for being a guest moderator for us today.
Great. Thank you for having me. What a pleasure it is. I feel very honored to be invited to be here tonight. I'm first going to turn to Dr. Backer to do our land acknowledgement.
Thank you so much, Joanne. We'd like to start off tonight with our land acknowledgement. McMaster recognizes and acknowledges that we are located on the traditional territories of the Haudenosaunee and Anishinaabe nations. This territory, covered by the Upper Canada Treaties, is within the lands protected by the Dish with One Spoon Wampum Agreement and is directly adjacent to the Haldeman Treaty territory. Thank you. Next slide.
Great. Thank you. So a few housekeeping items for us tonight. This meeting is being recorded and it will be posted on the website for the Program for Faculty Development, so you can come back to review it again later. We invite you to turn on your cameras if you feel comfortable doing so, but we would ask that you mute yourself unless you have a question and you would like to speak. You're welcome to add any comments or share ideas or ask any questions via the chat box, which can be found if you move your cursor to the bottom of the screen. You'll see the word chat. If you click on that, it will open up a chat box and you can enter comments and questions in that area. And we'll be monitoring the chat box over the course of the webinar. I think that's it. So moving forward, we want to review the objectives for tonight's webinar. Before we do that though, okay. So the objectives for tonight, we hope that we will be able to describe for you some of the strategies that can be used in supervising residents in the virtual care setting, and really to be thinking about what kinds of visits may be amenable to training in this type of care model. You may be surprised, in fact, how diverse this actually could lend itself to be. We then will move on to talking about how to plan your day as a supervisor in the virtual care environment. And of course, most importantly, we will hope to help everyone gain an appreciation for the resident perspectives when thinking about supervising within virtual care. There are a few things that we are not going to focus on today that may be questions people have. One is actually how to do virtual care. We will touch on that, but it is not the focus of tonight's session. If you have questions about that at the end, please stay on and we will try to answer some that you may have. As well, tonight we're going to talk about the initial part of actual supervision. We have reserved talking about feedback and assessment for our second portion of this webinar, and that's going to be held on July 23rd at 7 o'clock. Again, you can register through the Program for Faculty Development. To set the stage, we would like to briefly talk about virtual care and training residents within that setting. So we're going to turn to Dr. Yousuf to lead that way. Dr. Yousuf.
Hi. Thank you for the introduction, Joanne. I'm an internal medicine doctor at McMaster, practicing primarily at the Hamilton General. And I'll be giving a brief intro and overview about virtual care. And then we'll, after my section, we'll really get into the meat of how to supervise residents effectively in a virtual care setting. So next slide, please. Virtual care is basically whenever you're using a video, audio, or chat messaging platform to provide care to a patient in a remote location from where you are. And so when we're doing this, we need to figure out how are we going to integrate our resident effectively into this model. This can be done through a number of ways, which we'll be discussing in this presentation. And so you want to also think about the physical setup and space of your clinic. Will you be having your resident be in your clinic with you, but in a physically distant space or in another room? Or are you all completely remote from each other? Your patient is in one location, maybe even their home. You are in another, like your clinic or home, and the resident may be in a clinic or in their home. So you want to first think about the physical space of the actual clinic and how you're going to make it work. Next slide, please. Within virtual care, we have two types of care. The first is the synchronous care, and that's, for instance, like an e-visit. So for instance, in Ontario, we have our Ontario Telemedicine Network. You can do an e-visit where you're meeting with the patient either through video or audio in a clinic or in their home. So your typical synchronous care. It also includes communication between clinicians. So for instance, if you're using a service like e-consult, where a patient is presented to a specialist in a remote location and they provide their consultative advice over a virtual medicine platform. This also includes apps like WhatsApp, where information can be shared. Just remember, whenever you're doing this communication, you have to try to make sure that you maintain confidentiality, and whatever app you're using, it's PHIPAA compliant. And if you're not using an app that's PHIPAA compliant, that you use minimal patient identifiers. Okay, there's also the asynchronous care that we provide, and that is essentially if your clinic is using patient communication solutions, so different apps to share information with patients, to book appointments, to provide follow-up information. You want to be thinking about how you can integrate your resident into that, because that's a learning experience for the resident as well, and it will help them, you know, if down the line they want to provide virtual care in their practice. It helps to integrate them in these solutions early on, so they're able to do that effectively. Next slide. One of the feedback we've had from residents is the difficulty they're having with being, you know, and they're uncomfortable with not being able to completely do the physical exam. So, you know, from a patient safety perspective, but also from a learning perspective. And there are a number of ways that we can help to mitigate this. The first is, choosing the right type of visits. Second is, currently we're in a pandemic setting, so it's hard for us to use extenders. But outside of the pandemic setting, it would be great if you're able to use extenders that help expand your ability to provide the physical exam, whether this be a physician assistant, nurse practitioner, or a nurse who can, you know, examine the patient while you are in a remote location. There are certain medical conditions that lend themselves very well to remote visualization, such as skin rashes. So if you're on a video call, if the patient has a high definition camera, or if you're using a remote dermatoscope, you can use that to really assess skin rashes quite effectively. In addition, remind your residents that you can still get some basic vital signs from most patients. You can get the patient's height. Most people have a weighing scale, so your resident can ask them to weigh themselves. And also you can ask them about home blood pressure measurements, because a lot of people nowadays have blood pressure monitors. In addition, if your clinic uses telemedicine peripherals, like remote stethoscopes to transmit heart sounds, remote oximeters to assess patient oxygen saturations, try to integrate your resident into retrieving this information and learning these modalities. This is particularly important in patients with chronic medical conditions. You know, the weights, the oxygen saturation, those are important for conditions like heart failure, COPD. It just helps the learning experience become that much better. In addition, people are, there are studies going on to develop validated techniques for certain physical exam via telemedicine. It would be a great learning opportunity for residents if you ask them to look up studies on this and see if there are ways that they can better enhance their physical exam via telemedicine or via virtual care. Next slide. The CMA has, and its virtual medicine task force has come up with some visits that are well suited to virtual patient care. These include medication renewals, follow-up on lab or imaging results, rash or skin conditions that I mentioned before, well suited to virtual patient care. The management of chronic conditions, so the continuing long-term management of chronic conditions lends itself very well, particularly if you're able to get a certain important information on the patient, such as weights and assess their edema. Health education also lends itself very well to virtual care. For instance, if you're counseling someone on oral contraceptives, this virtual care would be a great way to do this. And finally, a follow-up mental health care has been done very effectively, and Usha will be speaking in more detail about this. Okay, and I think it's especially important to think critically about the visits that are well suited to virtual patient care when you're involving resident, because a lot of us are learning how to do this effectively right now, and if we're both struggling and learning together, it makes the visit that much harder to do. So you want to select these visits and patients carefully. In internal medicine, we found there's certain consultations, for instance, that lend themselves well to virtual patient care, such as assessment of blood work abnormalities like elevated liver enzymes, but other conditions such as chest pain don't lend themselves as well. So you want to think critically about these things before you get your resident involved in the care. Next slide. Now I'll be handing it over to Amy to talk further about the patient care and resident supervision.